Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hello, everyone. Amy Brenner here. Today we're talking about menopause mythbuster number 2. I don't need a progesterone because I've had a hysterectomy. This just makes me absolutely crazy when I see this. And I see this on a daily basis with new patients. And the answer is yes, you do. When you were in your 20s and your hormones were optimal, your ovaries made estrogen, progesterone, and testosterone. And our creator, whoever you think that might be, actually did that for a reason. Our bodies are amazingly designed. And those 3 hormones have definite advantages and roles in our bodies. So just because you've had your uterus removed doesn't mean you don't need those other hormones. But where did this come from? So whenever I see somebody come to me and they've had a history of hysterectomy, and they're typically on estrogen only, I have to tell them this, and I always give them the background of why do doctors still think this? And I got to be honest, I was one of those doctors too. And how I was trained is I used to be one of those doctors where I only gave estrogen after a hysterectomy. And here's where it came from. You need to know a little bit about the history of hormone therapy. So let's go back there. So the first hormone to ever come to market was a drug called Premarin. And what this is it was a combination of a bunch of horse estrogens. And so this was the first and only hormone therapy to come out. And it really helped a lot of women with hot flashes and night sweats, which can be truly just debilitating for people. It also helped with vaginal dryness. And so the marketing efforts for this drug were, really phenomenal of, you need this Premarin if you're going to be feminine. Every woman needs to take this. And in fact, so many women did. And so it was on the market for several decades. And after a few decades, they realized that women who were taking Premarin had an increased risk of cancer of the uterus. And the reason why this occurs is that estrogen actually causes the lining of the uterus to grow, or it's stimulatory to the lining of the uterus. On a side note, estrogen is also stimulatory to the cells of the breast, or it can be stimulatory to the lining of the breast. So when the company, actually the drug company is called Wyeth, realized that this was happening, this is not a good thing. So obviously they had to do something about that. So what they did was they actually developed another drug called Prempro. And what that drug had in it is it was a combination of Premarin, the horse estrogen, and another drug called medroxyprogesterone acetate. Now, again, because that medroxyprogesterone acetate, it has the word progesterone in it, some people think that it's progesterone. And that's one of my major pet peeves. I see doctors talk about that medroxyprogesterone acetate or other progestins. They will call it progesterone. And I just want to scream from the rooftop it is not a progesterone. There is a distinct difference between what progesterone is and what a progestin is. What a progestin is where a drug company has taken the molecule of our bioidentical progesterone, altered it just a little bit so they can patent it, and that's what's called a progestin. So the component of medroxyprogesterone acetate is a progestin. So women who still had their uterus intact were given Prempro. And this prevented the increased risk of endometrial cancer or uterine cancer because progestins do counteract that stimulatory effect of estrogen on the uterus. The downside is compared to those who were taking Premarin, when you had a uterus and took Prempro, people didn't feel as well as when they were taking Premarin alone. There was more bloating. There was more mood issues. Their cholesterol numbers and blood sugar numbers weren't as good. They're like, well, that kind of stinks. So therefore, the recommendation became if you've had a uterus or if you've had a hysterectomy, you only need to take Premarin. But if your uterus is still in your body and you want hormone therapy, then it's recommended you take Prempro. Unfortunately, that statement has just been generalized to all hormone therapy. What they don't realize, though, is progesterone, of what our body naturally makes when we're younger, has so many beneficial effects. And just because you've had your uterus taken out doesn't mean that you don't need progesterone. Progesterone can help with sleep. And anybody that's been perimenopausal or menopausal, almost all of us know, including me, that progesterone helps with sleep. And the reason is that when you take progesterone by mouth, it gets metabolized through your liver. And the metabolites are something called allopregnanolone and work on the GABA receptors in your brain. GABA is one of those things that causes relaxation. So when you take progesterone orally, you sleep better, you're more relaxed. Also, just like progestins, it inhibits the stimulatory effect on the uterus. It also promotes breast health. There's a big study called the EPIC E3N study where there were 80,000 women in this study who were given natural bioidentical progesterone, and they actually had a lower risk of breast cancer. There was also no risk of getting a blood clot. And so natural progesterone can be more breast protective. There's also an element of progesterone helping maintain bone mass, which is another issue when women go through hormonal decline of leading to osteopenia and osteoporosis. And last but not least, progesterone can decrease inflammation in the brain. In fact, there have been studies done where people who are having traumatic brain injury or concussions are actually treated with progesterone to decrease the inflammation in the brain. So long story short, just because you've had your hysterectomy doesn't mean that you shouldn't take progesterone. Hope this helps.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.